Lee, Melinda, Cameron, Danielle, and Linda. So that's 5 of us. And I think we have 8 on the board currently. So I think we do have a quorum. But I'm not sure that we're going to need a quorum anyway for purposes of this meeting because we don't have the meeting minutes.
Okay.
So Commissioner DeBonne will be joining, and so will Cameron. So we probably just want to wait till they pop on.
I have a question. I'm only seeing 6 on our screen. Do you have two Zooms going at the same time?
We had 2 different links, and so Commissioner DeBonne, Cameron, Danielle, and I were on the other. We used the link on that was embedded in the agenda, and so we were in a separate meeting. But then Dana emailed us a different link, and so Danielle and I are on, but Cameron and Commissioner DeBonne should be joining shortly.
Okay, I was going to ask if you wanted us to leave and click another link or something, if that would be helpful. But if we're in the
No.
right place, okay, good.
Yeah, we don't want to go back to that one. I think I'm not quite sure why there's a delay in getting Commissioner DeBonne and Cameron. Oh, I bet I know. Cameron.
I didn't realize Commissioner DeBonne was in that other meeting as well. I was just told about 2 people, so I just sent them the new link as well.
Does anybody have Cameron's cell phone number? Because she had, before we switched over, she said she's here. She's just got her video off because she's making herself a sandwich.
Yeah, I have her cell number.
Do you mind texting her and just having her check her email for the new link?
She just emailed me right now and I just emailed her back. So she should be hopping on.
Okay.
But feel free to text as well. Just let me know. There's Commissioner DeBonne.
With the cost of fuel, I determined that I didn't need to drive from La Pine to Bend today, so that's how I'm remote.
Fair enough.
Makes sense. I know I'm doing a lot more by Zoom and a whole lot more on Amazon.
Oh boy, yep.
By the time I drive to town and impulse shop plus use gas, it's easier just to buy the one thing I need and let it be sent.
I know the world's changing right now. I mean, we've had this technology, but with the cost of fuel like that and time and the busy roads, it gets dangerous out there. And Amazon distribution center in our backyard now. Holy
It's
moly.
like a celebration.
Like we got Cameron.
Looks like we've got everybody. Hold on, I gotta let my dog in. It looks like we have everybody. Lee, do you want to?
Yeah, we can call, we'll call this to order, with everybody here and present. Don't believe we have anybody new, for any introductions, with, Captain Gill not in today. And since we're gonna move the meeting approval to next month, and things, let's just jump right into the director's report and I'll call from the report the combination.
Okay. Hi, I'm here for Shanna Frister as far as the director report, and I also will do the set update as well. So should I just read through all this? So
I don't think she was like read it for me.
no, but just highlight. Okay. Well, I can't speak to the first kind of milestone on the do they have this?
Yes.
Okay. Yeah, centralized scheduling and clinical efficiency. So I've been greatly involved in the implementation of the centralized scheduling of no-show management implementation, where we started in our NOCO clinic back on July 1st, and that is going really well so far. We have hired an engagement specialist to help with the outreach and engagement component of that, and are in the process now of getting prepared to launch our Courtney clinic, which we are planning on doing on September 21st. It's going to be a much more complex implementation with all of the different teams that are here at the Courtney clinic. So we are moving along really well with all of that. The main kind of focuses of those implementations are to improve access for clients, really making it more seamless for them to reschedule appointments and get into care, and reducing our no-show rates with our engagement specialists reaching out and talking with folks when they have a no-show and discussing barriers and trying to help support with the engagement in care. And it also is taking some of the administrative burden off of our clinical staff by having that admin or that engagement specialist reaching out rather than our clinical staff doing that part of the work. So far it's going really well. Let's see, financial and contractual milestones. Our budget was approved. Our CCO contract with Pacific Source was signed for 6 months, so that'll be good through the end of the year. And we will resume new negotiations this October for the next CCO contract for the next fiscal year. So more to come on all of that. We are celebrating 6 years of providing critical safety net services at our stabilization center. So that's super exciting. There's a bunch of highlighted metrics there for you. You want me to read those? No? No. I would say review those. They're very impressive. Things are going really well at our stabilization center. So what's next? October 2028 budget planning. So we'll start getting that going here pretty quickly. We just wrapped up 2027, but that means now we jump into the next round. QI project execution. So we are partnering with Epic Ocean, our EHR, to develop processes that easily identify clients whose OHP will end or needs renewal, just anticipating all the administrative kind of burden of that, really working with Ocean and Epic to help us be able to identify those easily so that our case managers can help support people in getting their OHP renewed so they don't drop out of care. A youth subacute groundbreaking. So super excited to celebrate the kickoff of the new youth facility build on September 29th at 1 p.m. in Redmond.
We'll send you guys the invite.
Yeah, cool. And then our secure residential grand opening. So alongside that youth project, we are eagerly anticipating the grand opening of the adult secure residential facility. Looking at that opening up hopefully the end of January, which is super exciting. Super exciting. Cannot wait for that. Clinical voice integration. We are creating new opportunities for staff to provide written feedback on policies and procedures prior to the development and renewal, ensuring their voices are part of that process. And then expanding peer leadership. I've also been greatly involved in this effort. We just recently held interviews and selected 3 of our peers to move into peer lead positions, which are created to help support all of the peers in our organization. We have around 30 peers. And for the last couple of years, we've been piloting a peer lead on our AOP and hub teams that was written into our veteran peer support specialist grant. And that peer lead has been supporting all the peers on those 4 teams. And it's been really, really helpful to our peer workforce. So we've expanded now, adding 3 more to help with the other teams within the behavioral health department. So that's underway. We are in the process of spending the month of September kind of onboarding them and getting them oriented to the structure and expectations, and then they will be helping to support all the peers. Let's see, we're adding case management to peer delivered services. So our peers will be able to bill case management or use the case management code and deliver case management services as is appropriate for the services that they're providing. So it's just expanding the role just a little bit. Our South County remodel is still in development. We are anticipating construction to start towards the end of October, beginning of November. So we're planning for that and working on our service continuation plan to make sure that we're still able to serve the clients of La Pine during the remodel. But that is coming up very quickly. Adult foster care homes. Our Brighton Bush home is prepped and ready for a remodel. We also anticipate closing on a new adult foster home, Daily Estates, this month. Meanwhile, our newly purchased IDD adult foster home has finished its redesign process and is actively seeking bids. So everything is moving along there. And finally, transitioning crisis line to 988. Over the next 6 months, we will be working to shift from our county crisis line to encouraging the use of 988. Just like 911, 988 routes calls to the nearest crisis center based on geolocation. And we are working with the OHA to be the first in the state to create this universal accessibility when someone needs it most. So exciting change there. Or did you finish? I think that was it. Okay, thank you. Thank you, everybody. Any questions about any of that? I know that was a lot, very quick.
I actually have a couple of questions. This is a great director's report. I feel like it's really comprehensive and organized. I love it. So thank you for delivering that. A couple of questions, and this is a little bit getting ahead of us because Mary's going to help talk about our new direction with the RIP. But there's a couple pieces on here. I was wondering, like the clinical voice integration. Where was that? So that's new opportunities for staff to provide written feedback on policies and procedures prior to their development or renewal. And then also the expanding the peer leadership. Would it be appropriate to ask them to come and present to us? I know we have to protect confidentiality of clients, but I'd be really curious to hear from both groups what they're seeing, what their concerns are, what themes or trends, what issues and challenges there are. And I think that would dovetail perfectly with some of the work that we will be likely doing in the coming months.
Yeah, I can't necessarily speak to the clinical voice integration. I don't honestly know too much about that, but we can have Shannon follow up with that piece. But with the peer leadership, absolutely. I know that David Bliss, who is our peer lead for the AOP and hub teams, would love to come and chat with you and share what we're doing. And I think as we get the new peer leads oriented, it would be great to have that team come and talk with you all. They would love to.
That'd be great. And I'd love to hear from the people that they're working with as well. But I know there are some obstacles to accessing their voices directly. But I wonder if, some of them might have some people that they work with that might be interested in presenting to us. I've been kind of thinking through how do we access and listen ourselves to the people who have lived experience or are living experiences now. And I think that's a little bit of a tall order, but that might be an access point. So,
I mean, at the very least, I know that we can ask for input and feedback from some of the clients that we are working with and with the said report out, I could give you actually some client quotes from current clients about the programming that we're doing. So we could do a similar thing with some of the clients that peers are working with as a starting point anyway. And then if there are peers that, are open to coming to present, we could work on that piece as well.
Okay, thank you.
Yeah, absolutely. Can you make sure will you be taking notes? Yeah. Thank you. Cool. It's also recording. Oh.
Well, the site update is the next step. I think that's what we're looking for.
Yeah.
We're closing the book on the director's report. Sounds like. Thank you again for sharing that.
Yeah. I can move on to some of the work that we're doing regarding co-occurring treatment. So our Cosmos, did we come and present here with Cosmos past?
No. But the word's been, the term and the program has been floated around.
Okay.
I know Shannon last month was very big on that. We're doing that now and it's going really well.
Yeah.
So we've heard it.
Okay, I would like to offer the opportunity for our Cosmos team to come and present our program to you all. I think it would be very informative. We have been presenting to other community partners and getting the word out of what we're doing and how things are going. So our Cosmos team is our co-occurring treatment program here at Courtney. We work with adults at this point. However, we are currently expanding out to the child and family teams, and we're starting a Cosmos Junior for our youth. And that's in process right now. And we're also working on implementing the adult program at our Redmond clinic with Lapine to follow after the Lapine remodel. So we delayed that one just because of the remodel. Yeah, this program has been enormously successful. We're finding that this is a very challenging population to engage in care. People who have significant mental health issues as well as significant drug and alcohol issues. It's very difficult to engage in traditional outpatient programming. And so we've taken the approach of doing what we call assertive outreach, which is, when someone's been referred to us, we will go to them. We'll do whatever it takes to start developing a relationship and getting them engaged in care. And so far that's been working really, really well. We've gotten a lot of feedback from our clients and adapted our program to adjust to what they're saying is working. We offer these group clusters on Mondays and Wednesdays and Fridays, where clients are showing up, and our group attendance for this program is above and beyond what our other outpatient group programs are. So we're seeing a lot of positive outcomes as far as engagement goes. We had graduated our first client in July, meaning that someone successfully went through the program, is doing really well, and is no longer in need of that level of care from us. Some of the quotes that we've gotten, I thought maybe you might be interested in hearing what our clients are telling us. Cosmos has been different because of the mental health aspect. It is helpful to do both mental health and SUD together. I have more understanding of the disease now and why it is so powerful. This program has taught me a lot about patience, taught a lot about compassion, sitting with people still using, has made it easier to not beat myself up. Cosmos is not shame-based, and returning to use doesn't mean ending the program. It just means trying again. So really our philosophy is really meeting people where they are and walking through their journey of recovery with them, and shifting the narrative from that shame and stigma to this is part of the journey, and really supporting people all along that pathway. So we're very, very excited because we're getting really good outcomes, and we're growing. So yeah, I think it'd be great to have the team come and present. having our peer support specialists and the therapists on the team and our case manager, they're all so passionate about this work. Some of them come with lived experience themselves, and it's really fun to listen to them talk about the work. So I'm happy to do that if you would like that.
Yeah, thank you to that. Yeah, without jumping to later topics, but that definitely fits within a lot of what we're trying to accomplish in our bylaws and in what the framework we're using with Mary's help. We can definitely have cosmos and you know, what's the essential like de-identify companies food parking spots, successful that's good, like all that stuff definitely fit a lot of what that, but that's cool. Thank you.
One of the other, just one more little piece, one of the other, I think, important parts that we're working on is our partnerships with other community partners. We're in the process of finishing up an MOU with Recover Together Bend that offers detox and residential. And we have already a really strong working relationship with helping people who need to get into that higher level of care, get there seamlessly, and then come back to us. So that's been working really well. As well as other partners. At that SED forum that I've mentioned before that meets on a monthly basis. We're collaborating and sharing a lot of information there to make sure that we are breaking down the barriers and the gaps that people tend to encounter when they're transitioning between programs or between levels of care. So that's a very important focus of our work as well. Thanks.
Any final questions, comments for Chris? All right, well, thank you very much. Commissioner DePaul. Floor is yours.
Good to see everybody here. Kind of end of the summer. You can feel it just the end of the summer, right here at the edge of it. A couple of thoughts. The courthouse project was just completed. So Deschutes County Courthouse. We have a few new judges, but we have a premier facility now, and it's a welcoming environment, very professional, well lit, and it's going to be good for everybody because there's court cases that happen, but also custody, mental health, addiction cases that end up in front of judges. The whole spectrum. But we've got a wonderful facility. We even have a whole floor that's not built out. That could be two new courtrooms in the future. So just for everybody to understand, we're kind of leading the pack in the state now for the newest, best facility. The next thing is the court staff has all been moved from the oldest courthouse building. The district attorney's going to have plenty of elbow room to do their job too. So that's a real good thing in the public safety world. Southern Deschutes County remodel has been already mentioned here. We've got a county building south edge of the city of La Pine. And remember, there was a possible partnership with La Pine Community Clinic that didn't fall into place that we were looking at putting joint operations in. But the La Pine Community Clinic has their certificate of occupancy, and they're going forward. So I'm going to do a little outreach to the community clinic. I talked to a couple of board members, and I left a message for their director. Just to compare notes here before the end of the year, we're going to do a project. They're implementing their new facility space right now, so we're going to communicate with them. Make the best of it here in Southern Deschutes County. Spoke to Captain Gill at that courthouse opening and welcomed him to this advisory committee. I think he mentioned he saw a conflict for this meeting right away, but he's looking forward to participating. So he was honored that we finished that, and the Board of Commissioners did do that appointment. Also, I made a phone call to St. Vincent de Paul director here in Southern Deschutes. Love Pearson is her name, and just to see kind of an outreach for board members, see who, either her or somebody she knows, or just getting the word out, Southern Deschutes. And only because that's the person I spoke to, but anybody across the county, we're looking for members of this committee. And I'm just doing a little effort down that path. Yeah, I think that's all I got.
Well, thanks. Is there any questions, comments for Commissioner DeBonne? Right. Looking at membership, like I said, we have Captain Gill. He'll be here next month. Cameron, did you have any other updates with the membership committee? Just since we do have time for that, whether you have any prospective people coming in.
Very brief. Looking for more members. I have a date to chat with Carrie. I'm blanking on her name. Who resigned a couple months ago, just to kind of check in on if there's anything we missed on, because she seemed really excited, and then something about scheduling, but I just wanted to get her thoughts. So I'll be meeting with her next week, or just actually having a phone conversation. And then Lindy, who works for the Shepherd's House, was super interested in, and I sent her an application, and I followed up once, and I'm going to give it another couple days, and then I'll check in again, because I think she'd be a terrific asset, both lived experience and professionally. But that's all I got right now. So if anybody has anybody in mind that you'd like me to reach out to recruit them in a sense, or if you've heard of other ideas on how I can and generate more interest, please let me know.
And then Cameron, if I get anybody engaged, I'll send them your way.
Yeah, that's great. And I think just to even emphasize, it's totally okay to participate virtually, you know, maybe even when you talk to, is it Love at St. Vincent de Paul?
Yeah.
You might have some connections, or,
Yep.
Yeah, it's just, I don't really know. I feel like maybe a year or two ago, we got a lot of folks interested, including parents, and, but now maybe I just haven't had the opportunity. It's summertime, that sort of thing.
Yeah, and we can talk about switching to a virtual format for most of our meetings. I don't care how people attend. I just want people to attend, because we have had some difficulty in recent months making a quorum. And so if you reach out to people, just, emphasize that attendance is important. The method of attendance is not.
Awesome. Well, thank you, Cameron. Appreciate that. And now, we had, thank Dana for sending it out a while ago. There's an email earlier with a draft of a framework that Mary has been helping us, Jake Burns has been helping us, to sort of start looking at how we can, actualize working with the Regional Health Improvement Plan, RIP, supporting that within our bylaws, and meeting us where we're at as an advisory board to make some change and take some steps that are deliverable, actionable. Yes, we're growing and everything. And it did come out a little earlier today. It kind of goes over what the framework is, and then we looked at it again, we picked and thought about previously around the youth mental health objective area being a place we can look to do some work and create some goals and action. Again, against templates. But I'll hand it off to you briefly, Mary, to kind of talk about that, like 6-step listen through share kind of process for everybody there, and then we'll move on.
Sure, sounds great. Just to make sure I'm on the same page, I'm having a little bit of trouble hearing Lee, but would you all like me to do what we talked about with the more in-depth review, or are we still saving that for next time? And that you'd just like me to go over this kind of briefly now?
If you could go over it briefly now, and we can kind of highlight places of interest, some ideas to start honing for next month.
Perfect. That sounds great. Okay, I'm gonna pull up, hopefully, my screen
Excuse me
here.
just a second. This might be helpful. I put my closed captioning on because I was having trouble hearing, and we can do that individually. I just thought I'd throw that out because the room is, my computer's not real good, so I can read what I'm hearing.
That's a great idea. Thank you.
Counselor, I'm soft spoken.
Okay, everyone can see my screen that says BHAB RIP advisory framework here. Okay.
Yes.
Alphabet soup to start us off. So, what I have done here, I know we all have talked a handful of times about the bylaws for BHAB, say something about integrating the regional health improvement plan into your work. But what is an actual tangible approach to do this to help you all move forward? So I had some conversations with Melinda and Lee to kind of explore that. I know you all voted last time to work on, or at least get started with, some of the youth behavioral health initiatives that are included within the RIP. So this document is just a draft, and it is my best attempt to kind of start down that path of taking something that is a little bit ill-defined and turning it into something tangible that you can move forward with, that is also within your capacity as a hopefully growing coalition of people coming together to make change here. So what I have broken this down to are just a handful of steps that hopefully it is felt that are all within your capacity as an advisory board. The first step, and I should be clear that this could fit with any topic you choose. So could start with the youth behavioral health objectives and then evolve to other things as you move forward. And hopefully this makes it easier for you to continue with that work, even if I'm not here to kind of walk you through the roadmap or the framework. So the first step is really just listening. A couple of ideas have already come up of the Cosmos team or the peer leadership. It could be healthy schools, which you've talked about in the past. So really stepping into that role of hearing from the people who are most affected by whatever topic you have chosen to explore. You would have some guiding questions for what information you're trying to gather from that. And then each one of these steps has a simple output. So you have folks in, they talk to you, you ask them these guided questions. The output of your board is just this summary of themes that we heard. So you take what you listened to and step into, okay, what are we going to learn from this to really take it one layer further within our role? Looking at what exists and really exploring resources that are already in the community or people, organizations who are doing that work before you try and travel down, okay, what can we change or what can we do now? So you take your snapshot of these are the themes we heard. You add in these layers of, okay, here are some things that came up in conversation as we're strong here. We have some gaps here, and we all have questions left about this. And that's really where you start to go over the bridge and into, now we're going to try and connect with other organizations or people who are working on similar issues. So that could be, we want to connect with other groups in Deschutes County who are working on this same topic or initiative and see if we could coordinate with them. Maybe it's the Public Health Advisory Board. Maybe it's the Central Oregon Suicide Prevention Alliance. So looking at some of those partnerships and how you could coordinate. And then you move into, okay, we've gathered our information, we've heard from the people impacted, we have some ideas. Now we're going to move into that role of, we're an advisory board, so we're going to advise. And your output is really going to be this short prioritized list of recommendations that you take to those partners that are listed in your bylaws, health services, and the county commissioners to say, this is who we heard from, this is what we learned, this is what we would recommend. and really just sharing, that final step is sharing and revisiting. We're going to communicate our recommendations and how we want to track what comes next, and provide brief updates to leadership, whatever that looks like, on how things are progressing. So none of this is about really BHAB taking on, we're starting a project, we're owning the project. It needs a lot of capacity, and it's really more of, I could take any topic I want to work on and apply these 5 steps to step into what is outlined in your bylaws and allow you to do your work with a little bit more of kind of guardrails on it without being too restricted or over asking of your capacity. Any questions so far? And then I'll give you just a very brief flip through of this document.
Mary, I think this looks great, and I feel like your team is doing the work for Lee and I in driving us forward, but I think it's really great. Thank you.
Yeah, happy to help. So as you flip through this document, there's a few pages in here that gives you some ideas, really the broad strokes up at the top. And then as you go down, I've tried to sort of illustrate what this could look like with the first initiative that you voted on. So you said we want to look at youth mental health objectives. And I went through the RIP and sort of laid out, okay, what could listening look like on this topic? What could the learning look like? What connections might we look at? And so really trying to take the abstract and turn it into tangible to help you all move forward.
One thought for us as a group is what is the starting point? When you say youth mental health, what's the vision? Because the starting point, the proposal starting point is, well, we're going to sit here and listen to what people have to say. Oh, well, relative to what? So I'm just thinking the very beginning of this may be really important. As I say, this is for all of us to discuss. What is the state of mental health that's optimal, or that we're focusing towards, that reference point of, okay, that's going to be a healthier moment than now, instead of just starting with the fact that, okay, somebody needs to come to us and tell us something. Yeah, so I'm just thinking the starting point is going to be very important.
I don't know if we're using raise hands, but I raised mine. May I comment? So an example might be that there's a stigma in asking for help. And so people with mental health issues are experiencing things that an outsider would diagnose as a mental health. And so we might, listening to Tony's comment, particularly start with probing about why is it that people who are experiencing mental health issues either don't ask for help or we don't find a way to offer them help. And removing, if there is, and maybe it's stigma, maybe it's not, maybe it's lack of information. And I will say as an aside, I'm on another committee that's an advisory committee, and I'm looking at your work and I'm looking at our work, and the philosophy is identical, and I'm excited. I'm thrilled to see your ability to make advice a concrete deliverable, because that's been a challenge. So thank you for this great document. But that's kind of my thought on, we would narrow down that mental health aspect of shame. Why don't you get help? Maybe you don't think you need help. So how do you identify, I could use some help here, especially at a younger age. They might, I'm kind of babbling here, but maybe somebody could summarize what I said a little better. Yeah.
Yeah, I think that's a great example of a starting point. And this is the challenge when you bring any group together with varying lived experiences, professional lenses, all of these things. It's the challenge of getting, this is what the Health Council does with every topic. How do we get from this big, huge need into something that we can move forward with? And of course, we helped facilitate and write it. So my bias leans toward the Regional Health Improvement Plan, but I would really encourage you to look through that because it does sort of provide those layers of entry points. So I just pulled up the mental health topic in our current RIP, and it gives you this goal, that future state that Commissioner DeBonne mentioned of, okay, by 2029, to improve belonging and reduce suicide in Central Oregon, we will use collaborative, integrative approaches to ensure a culturally responsive, holistic continuum of services, ... Right? So there's a very large entry point, and then as you move down, it gives you some very specific pieces that are about schools and how we're screening kids in schools for mental health concerns or pieces like that. So part of what Melinda and Lee had spoken with me about is that maybe next month I could come back and really almost take you through a little bit of a strategic planning sprint of sorts to kind of narrow down to, hey, this is what we want to do first.
Does that make sense, Linda and Commissioner DeBonne? I mean, they put so much work into helping us kind of find a direction. Lee and I were trying to do that earlier this year because it felt to me like our group was just a little bit aimless, like bringing in some presenters and then, okay, what do we do with that? What's our deliverable? Because I'm very much a deliverable type person, and our board is set up a little differently than that. Because of what our mission is. We are a statutory board, first of all, and we need to be advising Deschutes County Behavioral Health and the Board of Commissioners. And so it's a tough one for me. I've led other committees and other boards. This one is a challenge trying to figure out how do you drive it forward and actually make a difference other than just meeting and listening to people and for our own personal knowledge. And so again, Mary, I'm really grateful for you and your team to put this into a concrete plan. And it just, so I think we can have some more conversation about that in September, and we'd love to have you come back for that. And then we can get into the nuts and bolts. But last month, for those of you that weren't in attendance, we did, Mary and her team had suggested that we kind of choose a focus and that maybe we spend, a number of months on that focus, incorporating this structure, and then we can vote on another focus, and we decided youth mental health was our focus for this first foray into that. And so we can at least get started on that next month. So again, thank you. I feel like you're doing our jobs for us.
I'm happy to help.
And, I think in a lot of ways, we've been looking for something to be a long-term sustainable practice that replaces, like we said, someone comes in and talks to us and we don't know what to do next. We want to have something that, not that there's always a next that we're always doing, but that we have something that's not so month to month and feels, disjointed and not connected. Even though when you look at the format, every month we're doing step 5 and 6 because we have the commissioner and the director here all the time. So in some ways, we have an opportunity to really always have a deliverable, but always have accountability to what we're trying to do, which is create something sustainable. And I think in terms of like, where's our starting point? It's almost like, forget the technical term, but it's like a movie or a book that's the first scene is the end of the movie. And when you think about the regional health bullet points that Mary's talking about, we're planning towards that, right? We're starting at the end. We're wanting to get to 2029 outcomes. And that's where we're starting from. So that's where we want to be. And how do we look at that? And we're not voting on anything today, per se. I think I would like to challenge everybody for some homework. Like, come back with like, what would you want that outcome to be? And that can be part of our conversation in September. Start taking the burden off Mary and them, but you can come in and give us accountability when we're not on the path, right? And really then go from there to create what could be something functional. Some of these steps, I think, could be done in like 90-day chunks. If we're focusing on, we just had Cosmos and the input of the residential center and various things like that could be winter. That, we can start to have a bit of a planning our year out in a way that gets us through these. And I would also say so that we're more engaged and we're not falling back to what we don't like. Maybe I don't want to say subcommittee, but we either assign or have volunteers out of the board members. Like, you're the ones leading the conversations. You're the ones asking these people what we can do for you, or asking the challenging conversation, what are you doing about that we know is a problem, or that how can we help you or not duplicate services, right? And you can start to have more investment and participation is an unfair word, but I think more active and engagement to respect the participation that we get. And that's a lot, but like I do think we can move forward with this in a way that isn't reinventing the wheel, but like we could put some nice spinners on. Like it could look shiny for a change. See, thanks for protecting some of this.
I have a rather tangential idea. Since this group is wanting more members, it might be interesting to use this process on what can we do to get more members, even though it's looking at our own issue, but that might be an interesting way to practice the process here. If that,
I mean, I think if we get enough folks coming in of various scope and practice, and we can actually get community members in, which has been a long-standing request, concern, lagging deficit of this group for years since I first heard about it. Unless you're a community member that wanted to be on the board, it didn't really show up. But I think if we do this right, that'll be a natural consequence and a happy accident. Linda, I think you're right that we should look at it, but I think it'll happen.
well, it would be low hanging fruit, low risk. We're advising ourselves, and we might be surprised at how easy it is once we brainstorm. Anyway, I'm not selling it, just suggesting it.
Of course.
I'd also like to challenge everybody, and I'll send out an email. And I think we mentioned this at the July meeting, is to, if everybody could think of at least one person that they would like to have us contact, or that you can contact. I can, I'll send out a email to all of my special education directors throughout all of the schools that are districts that I represent. But if you guys can all think about that too, and send Lee and I, or actually, I'm sorry, Cameron, send a name and contact information and say how you think it would be best to contact people. Would it be better to have Cameron reach out, or would it be better for you to make the initial contact? But if everybody could come to the September meeting with one person, I think that we could make some progress on membership. And I think it's an exciting time to bring on new members because of this direction. And I think we can all feel proud of the work that we're doing, where, for a while we've been sort of spinning a little bit. So it should be easier to recruit that way too.
Yes.
Danielle or Stephanie, any thoughts?
No, I mean, I have some thoughts, but I need to mull things over. I appreciate Mary's, work in putting this together. I want to make sure we don't lose focus with all these conversations, that we really want to get more people with, lived experience. I sometimes think that's missing from the conversation. And I also realize without Paul here, there's less and less conversations about the IDD community, which is also supposed to be part of what we focus on.
Yeah, I hear that, and yeah, we need to keep that going, and yeah, bringing Paul back, that's been something you especially, and others have voiced for a while, and I think finding the space for him to do was very easy, and hopefully happens soon.
I don't know where we are on the agenda.
We're actually somewhat on time we're actually ahead for starting a little late. But we are kind of in the middle in the input for members on what to do, where to go. If we're somewhat of closed that, we can sort of synthesizing, we can come back next month with hopefully some names given to Cameron for membership, some ideas about where to start, refresh that, look at the health improvement plan, so we can have more targeted start points and conversations. That may be the end of this part of the conversation, and if we're left with open discussion, we may have a slightly shorter window today to not waste it's time.
I'd just like to encourage everybody to try to attend the groundbreaking event for the youth residents in Redmond. It's on September 29th at 1 p.m. Dana sent out an email to everybody, I believe, with an invitation, kind of the details, location, but those are the kinds of things that I think are really important for us to show up at. I've got it on my calendar, so I will plan on being there, and if you guys can possibly do that, it would be lovely.
Can you put the details of that in the minutes, please? The time and address?
Well, Dana just sent you an email that has all the details. It is on. Do you have?
I found it. I found it. Thank you.
Yeah. I'm excited for that. We desperately need it. Okay.
Well, at this point, do we have any other open discussion pieces? Items?
Well, I have a brainstorm. I'm on the IDDAC committee, which is another committee that Paul attends. And an individual and I are co-chairing, creating a charter and a process, and it's turning out kind of like this, actually, unbeknownst to us. But I had a thought that periodically, and I don't know what that means. Well, that the common denominator is there are a whole bunch of people from a whole bunch of departments, and we're all doing good stuff and we're learning about it. But what do we do with what we're learning? And I wonder if we might consider some cross-committee communication, because we're dealing with a subset of what you all are dealing with, since IDD is still under your umbrella. And just to throw that out, I don't have an answer for it, but a thought that we have information that we can share and support each other, content information.
Linda, I love that idea and we're doing that also with Fab, trying to collaborate and coordinate with them. But I do love that idea. So maybe that's something that um, the way that Lee and I have functioned so far is that when there's an idea like that, we'll meet first to talk with the leaders of whatever other organization that might have some overlap. And so maybe you can send me an email, me and Lee an email and suggest like maybe a Zoom meeting just to kind of talk about areas that we could collaborate on that.
I think that would be great. And then a rather grandiose idea, and maybe too grandiose for now, is I'm a member of another group that a whole nother venue of volunteers. Once a year, they have a summit meeting, and there's a representative from all the groups, and they coordinate with each other and then go back to their groups. And it's big. It's about 40 or 50 people in the room, but those people are bringing aggregated information from another 50 to 100 represented by each of those 50. And we have such, I think, an abundance of really good resources for these populations. It's unknown. I mean, we have a wealth of information, in my opinion, better than anywhere I've ever lived. And but we can't find each other. It's just a labyrinth to get through as somebody with a need. And so that meeting every 12 months helps us reset our mental encyclopedia of how we can send each other to the people that need them. So
That, if you have dates for that, and you could send that, I don't know if that would go on like our old Google Calendar, but to attend that would fit, I think, under some of our outreach activities, to see it once a year, how that works.
well, the group is actually a Horse and Forest Service coordination. It's not in the community of special needs, but I thought the idea of a summit from everybody who does anything in our forests and trails. So, I mean, you could probably attend them. Well, I don't know that the content of that meeting would be helpful for what we're trying to do. It's just the process.
Okay.
Yeah.
I appreciate that, and I think keeping that experience and that drive going, is you and Danielle and others the big drivers of like the resource mapping, and like let's centralize where to find stuff. People who family members need a more central access point for all the info, to keep bringing that in and drive that in these discussions. Like that's a component. Those are the questions you're asking of the folks that come in and talk to us. Like, how do you do that? How can we better support that? If you don't, keep that piece up. That's important for sure.
I also think that's pretty much the work that Mary and her team are doing as well, to try and bring some stuff together. And I think that drove a lot of the reorganization of the RIP for this 5-year thing. And so I love that idea. And I think there's a lot of groups that feel the same way. We just need to connect, consolidate, be efficient in what we do, and go forward together. So, okay.
I think I'll call it our last awkward pause for the day, and actually puts us at a full hour with technical difficulties. So good job, everybody. Getting in there, it's summertime, end summer, all the things. And thanks for having a good conversation today. Yeah, at the end, please refresh on those PowerPoints. If you need those, email myself or Dana or Linda that, hey, I don't have that email, I can't find it. We can shoot it to you if you need that attachment again. For review for next time. Try and get names in the Cameron. So we can keep moving forward with this momentum. And yeah, I think we were officially call it closed. Since we're not recording, we talked about those meetings right? For motions today. And Yeah, thanks everyone for showing up. Get your
Thanks,
kids in
everyone.
this.